So when you look at Ammonoosuc Community Health Center's patients, approximately 40% are on Medicare because they're over the age of 65. There are approximately 20% of our patients on Medicaid because they qualify for that benefit. And about 20% still remain uninsured. So those are vulnerable populations that we have to make sure get the vaccine.
A large number of our patients are senior citizens, especially up here in northern New Hampshire. We have a rural, underserved, elderly population with a lot of chronic medical conditions.
Once we were notified that we were going to be the first in New Hampshire as a federally qualified health center to offer vaccines, I got a call immediately from the State Department of Health and Human Services and asked, how can we help you? That, to me, tells us the relationships we have with New Hampshire's Department of Health and Human Services is exceptional. It's always been a focus on the patients and the community. We work very well together, and I think perhaps that's unique compared to other places in the country.
We found out about 2 weeks before that we were going to be standing up our first clinic. It was a ton of work, and we had to make sure that we had adequate staffing, get all the supplies in, get all our emergency protocols in place, open up VAMs, learn how to use VAMs, get our patients notified. It all came together, and we were able to start off with our first clinic. We'll be rolling it out to more and more sites as we go along, making it a whole team project across the whole agency.
A goal would be able to get close to 500 shots a week, where we can do 100 shots per clinic per week. I think that will help us get everybody vaccinated in an expedient manner.
I'm Ellen, and I live in Littleton, New Hampshire. I'm a paraprofessional at Profile School. We went out for what we thought was 2 weeks of remote, and we were remote for the rest of the school year because of COVID. I absolutely wanted to get the vaccine. I think that it's the only way that we're going to get somewhat back to normal. It will allow me to visit my daughter who lives in Vermont, and it will help me stay healthy. I heard that my community health center was having a clinic, and I came right in and got my first dose of the vaccine. And I am very, very thankful for that. Just knowing that we're all vaccinated will be helpful. And as far as my plans, I'm going to go visit my daughter. I haven't been able to see her for a while, and the first thing I'm going to do is give her a big hug.
I think the patients are very thrilled about getting it. With the last year, the pandemic has taken its toll on many people, and I feel that they feel this is the light of hope that they have needed to continue on. This elderly couple called me, having trouble navigating the system. I got on the system with them, we went through it together, and I had them scheduled with us within the week. And she was so happy, it was like she wanted to cry, and told me that I just made her day. And I told her that she made mine because I was able to make someone happy.
We reach patients every day, but to be able to do something that's so impactful after such a rough year has been super rewarding for all of us. We've been able to come together as a group, but also be able to come together as a community to really make a difference. Standing up this vaccine clinic has given us a tremendous amount of hope.